NHA CCMA online practice test. Question 1. A patient requires an intramuscular injection of a thick, oily medication. Which needle gauge is most appropriate for this administration? Option A 18G. Option B 21G. Option C 25G. Option D 27G. The correct answer is option A, 18G. An 18-gauge needle is appropriate for viscous or oily medications because the larger bore allows the thick fluid to flow without excessive resistance or prolonged injection time. Smaller gauges such as 25G or 27G are used for subcutaneous injections and thin solutions. Question 2. A patient is prescribed an enteric-coated medication. How should the medical assistant instruct the patient to take this medication? Option A. Crush the tablet and mix it with applesauce. Option B. Dissolve the tablet under the tongue. Option C. Swallow the tablet whole with a glass of water. Option D. Chew the tablet completely before swallowing. The correct answer is option C. Swallow the tablet whole with a glass of water. Enteric-coated tablets must be swallowed whole because the coating is designed to dissolve in the small intestine, not the stomach. Crushing or chewing destroys the coating, exposing the medication to gastric acid and potentially causing stomach irritation or drug inactivation. Question 3. A medical assistant is administering an intradermal injection for allergy testing. At what angle should the needle be inserted? Option A 10 to 15 degrees. Option B 25 to 30 degrees. Option C 45 degrees. Option D 90 degrees. The correct answer is option A, 10 to 15 degrees. Intradermal injections are administered at a 10 to 15 degree angle, nearly parallel to the skin, to deliver medication into the dermis. A properly placed intradermal injection produces a visible wheal or bleb under the skin. The 90-degree angle is used for intramuscular injections. Question 4. A medical assistant performs a clinical task that is strictly outside their legal scope of practice, resulting in harm to a patient. This is an example of which legal concept? Option A nonfeasance. Option B malfeasance. Option C contributory negligence. Option D slander. The correct answer is option B, malfeasance. Malfeasance refers to performing an act that is unlawful or wrongful, such as practicing outside one's legal scope of practice. Nonfeasance is failure to act when there is a duty to do so, while misfeasance is the improper performance of a legal act. Question 5. A patient with a new diagnosis of type 2 diabetes mellitus tells the medical assistant, "I don't think I can afford my insulin or test strips." To which resource should the assistant refer the patient? Option A, the state's public health department. Option B, a medical social worker or patient navigator. Option C, the local emergency department. Option D, the pharmaceutical manufacturing board. The correct answer is option B, a medical social worker or patient navigator. A medical social worker or patient navigator is trained to identify financial assistance programs, pharmaceutical patient assistance programs, and community resources for patients with medication affordability challenges. The emergency department is not appropriate for financial counseling. Question 6. Which organelle within a human cell is primarily responsible for energy production in the form of adenosine triphosphate, ADP? Option A ribosome. Option B lysosome. Option C mitochondrion. Option D nucleus. The correct answer is option C, mitochondrion. The mitochondrion is the site of cellular respiration and produces the majority of ADP through oxidative phosphorylation. Ribosomes synthesize proteins, and lysosomes digest cellular waste. The mitochondrion is often called the powerhouse of the cell. Question 7. When applying a surgical dressing to a wound, which of the following layers is intended to be sterile and come into direct contact with the wound bed? Option A, outer elastic wrap. Option B, primary dressing. Option C, secondary tape layer. Option D, ABD pad reinforcement. The correct answer is option B, primary dressing. The primary dressing is the layer placed directly on the wound surface and must be sterile to prevent infection. The secondary dressing overlies it for absorption and protection. The outer wrap provides compression and secures the layers. Question 8. A medical assistant is preparing to assist with a punch biopsy of a skin lesion. Which of the following instruments should be included on the sterile tray? Option A, tenoculum forceps. Option B, biopsy punch and iris scissors. Option C, speculum and obturator. Option D, curette and uterine sound. The correct answer is option B, biopsy punch and iris scissors. A punch biopsy tray includes the cylindrical biopsy punch tool, iris scissors to cut the base of the core sample, forceps, a specimen container, and local anesthetic supplies. Tenoculum and uterine sounds are gynecological instruments used for intrauterine procedures. Question 9. A medical assistant is participating in a patient-centered medical home, PCMH, model of care. What is a core concept of this healthcare delivery design? Option A, fragmented specialty care focused on acute injuries. Option B, comprehensive, team-based care centered around the patient. Option C, minimizing communication between providers to reduce cost. Option D, prioritizing diagnostic testing over preventative wellness. The correct answer is option B, comprehensive, team-based care centered around the patient. The PCMH model emphasizes comprehensive, coordinated, team-based primary care that is patient-centered and focused on continuity. It integrates preventive care, chronic disease management, and care coordination across all settings to improve outcomes and reduce fragmentation. Question 10. When attaching EKG limb leads, which color electrode is traditionally designated for the right leg, RL, and serves as the ground? Option A, red. Option B, black. Option C, green. Option D, white. The correct answer is option C, green. In the AHA color coding system, the right leg electrode is green and serves as the electrical ground to reduce artifact. The mnemonic "Ride your green bike," right arm equals red, left arm equals yellow or black, green equals right leg, helps with lead placement recall. Question 11. Which of the following structures separates the thoracic cavity from the abdominal cavity? Option A, pleural membrane. Option B, diaphragm. Option C, peritoneum. Option D, intercostal muscles. The correct answer is option B, diaphragm. The diaphragm is the dome-shaped skeletal muscle that physically divides the thoracic cavity above from the abdominal cavity below. It also serves as the primary muscle of respiration. The pleural membrane lines the lungs, and the peritoneum lines the abdominal organs. Question 12. Which of the following medical abbreviations represents a medication that should be taken 4 times a day? Option A, BID. Option B, TID. Option C, QID. Option D, PRN. The correct answer is option C, QID. QID stands for quarter in die, meaning 4 times a day. BID means twice daily and TID means 3 times daily. PRN means as needed and is not a fixed frequency. Question 13. What type of healthcare setting specializes in providing care for patients who have a terminal illness and a life expectancy of 6 months or less? Option A, ambulatory care center. Option B, long-term care facility. Option C, hospice care. Option D, acute care hospital. The correct answer is option C, hospice care. Hospice care focuses on comfort and quality of life for terminally ill patients expected to live 6 months or less. It emphasizes palliative rather than curative treatment. Long-term care facilities provide extended nursing care but are not specific to end-of-life patients. Question 14. A clinical medical assistant is discussing a patient's new diagnosis of macrocytic anemia. What does the term macrocytic mean? Option A, unusually small red blood cells. Option B, unusually large red blood cells. Option C, decreased number of white blood cells. Option D, irregularly shaped platelets. The correct answer is option B. Unusually large red blood cells. The prefix macro means large and cytic refers to cells, so macrocytic describes abnormally large red blood cells. This is seen in vitamin B1, 2 and folate deficiencies. Microcytic, small cells, is the opposite finding, seen in iron deficiency anemia. Question 15. Which of the following cleaning methods kills all pathogenic microorganisms, including bacterial spores? Option A, sanitization. Option B, disinfection. Option C, sterilization. Option D, ultrasonic cleaning. The correct answer is option C. Sterilization. Sterilization is the only method that destroys all forms of microbial life, including highly resistant bacterial endospores. Disinfection eliminates most pathogens but not spores. Sanitization reduces microbial counts to safe levels but does not kill all pathogens. Question 16. A patient presents with a pulse rate of 110 beats per minute. Which medical term should the medical assistant use to document this finding? Option A, bradycardia. Option B, bradypnea. Option C, tachycardia. Option D, tachypnea. The correct answer is option C. Tachycardia. Tachycardia refers to a heart rate greater than 100 beats per minute in adults. Bradycardia is a rate below 60 bpm. Bradypnea and tachypnea refer to abnormally slow and fast respiratory rates, respectively. Question 17. According to developmental psychology stages, a child who is experiencing a conflict between industry versus inferiority is typically within which age range? Option A, 1 to 3 years old. Option B, 3 to 6 years old. Option C, 6 to 12 years old. Option D, 12 to 18 years old. The correct answer is option C. 6 to 12 years old. Erickson's stage of industry versus inferiority occurs during middle childhood, ages 6 to 12. Children in this stage are learning to master academic and social skills. Failure to develop competence leads to feelings of inferiority. Question 18. A medical assistant performs a urine chemical screening using a reagent strip. Which of the following parameters, if positive, indicates a probable urinary tract infection? Option A, ketones and glucose. Option B, leukocyte esterase and nitrites. Option C, bilirubin and urobilinogen. Option D, specific gravity and pH. The correct answer is option B. Leukocyte esterase and nitrites. Leukocyte esterase indicates the presence of white blood cells, pyuria, and nitrites are produced when bacteria convert urinary nitrates, both strongly suggesting a UTI. Ketones indicate fat metabolism or fasting, and glucose suggests hyperglycemia, not infection. Question 19. A medical assistant is checking the liquid controls for a CLIA waived gluconate device. How often should these quality control checks be performed according to manufacturer standards? Option A. Once every month. Option B. On days when patient tests are performed. Option C. Only when a new medical assistant is hired. Option D. Every time a new patient is brought in. The correct answer is option B. On days when patient tests are performed. Quality control for CLIA waived point-of-care devices must be run on each day that patient testing is performed, per manufacturer instructions and CLIA guidelines. This ensures the device is functioning accurately before any patient results are reported. Question 20. According to CDC hand hygiene guidelines, what is the minimum duration for scrubbing hands with soap and water? Option A 10 seconds. Option B 20 seconds. Option C 45 seconds. Option D 60 seconds. The correct answer is option B, 20 seconds. The CDC recommends scrubbing all hand surfaces for a minimum of 20 seconds with soap and water to effectively reduce transient flora. This is approximately the time it takes to hum "Happy Birthday" twice. 10 seconds is insufficient to achieve adequate microbial reduction.